Thank you very much for the interesting presentation. And
Do you want to say who you are, actually?
okay. I'm Dina Balabanova from the London School of Hygiene and Tropical Medicine. We had a very similar project, again, looking at success stories, good health at low cost. I had a question to Joe, actually. One thing that I think is unique about your project is really looking at beyond health, beyond the health system, the role of other sectors, and I think that's quite unique. I was just wondering, from the position of funder and also your observation of how the international debate is going, there seem to be very few studies that are looking at sort of social determinants of health or intersectoral issues. Is it because the way the institutions are structured? And obviously I'm in a public health school, so it's difficult for us to look at other sectors, but generally, from your point of view of Gates, the foundation, how do you find this intersectoral work? Is that easy, and is there going to be more of this?
Thank you. One right in front here. You also have to say who you are, even though we all know who you are.
Thank you. Claire Malamed from the Overseas Development Institute, and also I should declare an interest involved in this project. Thank you. That was really interesting. I mean, it strikes me that one of the things that we're doing here is kind of bridging the gap between the health research, which is focused on specific kind of diseases, conditions, outcomes, and the health research, which is focused on systems. And to some extent, those have been, at least, again, like Kevin, from someone who's not an expert on the sector, but coming into this from outside, it can sometimes appear like as if there are two very different approaches that don't often sort of speak to each other. And I think one of the great things about this research is that we're very explicitly and kind of talking across the two ways of thinking about health outcomes and how to improve them. The other point I wanted to make, I was very struck. Listen, yesterday the new head of the NHS in England, Simon Stevens, made a big speech to the kind of annual get-together of NHS managers, and I was really struck listening to Fiona's presentation how much of the things that you're talking about in this research around not seeing health systems as a monolith, looking at sort of decentralized approaches, where is the appropriate level for decision making, for delivery, for different actors, how politics play out, was absolutely echoed in the things that the NHS is grappling with, and the way that he was talking about approaches to the NHS over the coming period. I don't know what to make of that, but I think it's absolutely fascinating in thinking about health systems in general. We tend to sort of assume that development is kind of a law unto itself, but it very clearly isn't. This is a question about health systems and not really a development question, it seems to me.
Thank you. There's one right at the back.
My name's Bruce Mackay. My question is about why do we focus on success stories? Gino's book, Good Health at Low Cost, 5 case studies, all successful. This, all about success. 3 years ago, my company, the company I worked for, was named and shamed in the Sunday Express as a classic front page anti-foreign aid story. And the company put out a very anodyne press release in response saying what wonderful work we did, etc. And I was so cross, I emailed the journalist that night on my personal email. He phoned me back 10 minutes later, and he said, good news isn't news. Good news doesn't sell. No, doesn't sell newspapers. And it's absolutely true. It's not true just about aid and health. It's just as a general observation. He was actually extremely intelligent, very well informed. He'd have been perfectly at home in this room. And what he said is, where are the responses from your business to the very, very real things that go wrong in foreign aid? And that is my question to Joe.
Okay, so look, let's take those three. I mean, let's go in reverse order. Joe, do you want to respond to that? I mean, I was very much struck by, we had this moment, I think we discussed this before actually, where, when the UK hit the 0.7% target, and there was a resounding silence from DFID. That they didn't want to put anybody up. It was almost like an act of national shame that we've achieved this thing, and don't tell the Daily Mail because they'll crucify us. So, I guess that's part of the problem in the environment that you described a little bit earlier.
It is. As an American coming over and working here, and as someone who's been involved in trying to get countries to own up to their 0.7 commitment, it seemed like an obvious point that you would want to celebrate, and yet the resounding silence, as Kevin put it, was pretty profound. Look, it's I think in the current climate not a politically palpable issue, and yet I think you do see some signs. I was reflecting a bit on my time in Canada, where before the announcement that Prime Minister Harper made there last week, he dispatched a good portion of his cabinet to around the country, with each minister focusing on a different aspect of the upcoming MNCH announcement, because in some of their pre-electoral polling, they determined that the Harper government's leadership on this issue would play to his electoral advantages at home. And so I was really interested in that. I think there were some similar elements that had helped him detoxify a little bit the conservative brand of Harper's party. I think it helped with women, frankly, and raising some of the votes and interest as that Canada is taking an interest in issues abroad. But it's certainly not a calculation that I think. I mean, we will not see, I think, a highlighting of issues on international development. We will not see a lot on what this government, this coalition government, has done in the last several years. Even though it's a remarkable thing that in any other context you would love to see championed. I think we need success stories because it does help counter a lot of the prevailing myths that exist. You're shaking your head, but you start to. It's not an overnight process, but I think you do have to work with people who, for whatever reason, over the years have been brought into believing that things in Africa, whatever's happening, is going to be the same as it will for generations to come. That things just are not getting better, and that the stories that do get highlighted of corrupt dictators lining their pockets with aid money, buying jets and homes. I mean, I'd like to think that this sector and others can be a bit more creative in starting to counter a lot of that. And I think for us, success stories and just showing the progress that can be made and appealing, as ODI through the study has with this report about how it's done. What are those determinants? I think the more we put that out there and the more creative we're able to package it in a way that's useful for policymakers and drive a narrative for the public, the better chances we are to accelerate the progress in the future.
Thanks. Actually, there were two others. Maybe you could take one each. So, Fiona, there was the issue that Claire raised about the NHS comparison about the move towards more devolved governance structures and decision making. What the evidence from these studies might say about that.
No, I think that's really interesting, Claire, and I think it just shows more and more how I think there needs to be much more sort of learning and cross-fertilization between actually, south-north sharing and learning. Often it's going north-south, or we think it should, but and in fact I think from my reading of the case studies and understanding what's worked, I think there are actually lots of things that we could be learning here. Like, what really stands out is these community volunteers for us. And to be honest, I don't really know how it works in the UK, whether we do have community volunteers. I don't know, do we? So I think, I think it's exploring more these sort of the linkages and, how we could fertilize. I think it's really interesting, and maybe we should be having more conversations with the NHS here.
Thanks. Actually, on Dinah's point, that, one of the things that strikes me about this this intersectoral question is whether it's because of the MDGs or something different. There is a bit of a silo approach. We have MDGs on health, MDGs on water, education. And we all, I think, know and understand that in the real lives of real people, these things are all deeply interconnected. But I guess, Joe, that Gates has been a sort of real leader on public health issues, and probably less so on education. And yet, a lot of the indicators basically show that the really big health gains, in some of the areas that we're talking about, child mortality, maternal health, and so on, are more closely associated with maternal education in particular than with almost anything else. So I just wonder, looking ahead, is that intersectoral balance something you're looking at?
Yeah, I'm smiling a little bit internally. I was joking with a colleague yesterday about whether I was going to be able to leave a panel with Kevin and not get a question on education. We've had a good running debate over the years about the importance of education. Certainly acknowledge that. We've chosen to take on health, agriculture, two big areas, but definitely don't deny the correlation that education has in both of those. And I hope that increases over time. I think evidence that we're getting better on the intersectoral. I mean, I remember, I think it was probably a decade ago now at Gates, we commissioned something with CGD called Millions Saved. It was a report to try to also look at some of the factors behind some of health successes. And then our across the hall, our advocacy colleagues commissioned something called Millions Fed to document what works in agriculture. And now I think we're getting much better. Those teams now sit in one side of the foundation, and we're thinking much more about the correlation between agriculture and nutrition, health, and the interplay, and a lot of the cross-cutting, as it gets referred to commonly, the underlying factors that play into that. So I hope in the future we see more of that, both from us, but I hope just in what continues to get funded over time.
Thanks. Sorry for being so predictable.
Not at all. Not at all.
Actually, it is true on the other side as well that if you look at some of the really big barriers that are holding education back, if you put a group of educationists together, they'll immediately start talking about schools and books and teachers. And actually, it's often nutrition and health, which is a much bigger constraint on what you can achieve in education.
Yeah.
So let's move on to the panel now.